Welcome to Part 8 of CryoClear certification. In this section we'll be talking about the actual use of CryoClear and some suggested protocols that have been developed over time. The CryoClear works best when it is about 1/4 inch from the surface of the skin. Do not be afraid to have it closer, even though you'll see a white ring forming as the spray is directed at the skin. That is the ice and energy of the device focusing on the targeted area to be removed. The patient will experience just a small amount of tingling, and the white that you see is an indication that the product is being applied properly. Some suggested protocols, let's cover a few. So the first is skin tags or acrocordon. The removal protocol can be accomplished in all cases with 10 seconds or less of spray time. For skin tags, what we suggest is taking a hemostat or tweezers and lightly grasping the top of the tag. Lift it gently to expose the pedicle or the stalk, and place CryoClear approximately 1 millimeter or very close to the base of the growth. Spray for 5 seconds, not moving CryoClear but directing it at that stalk. Then move to the opposite side of the growth and apply again for 5 seconds. The goal here is to destroy the base stalk, which feeds the rest of the skin tag. This will give you your best chance of removal and is an easy protocol for the client to tolerate. Our next example protocol is for actinic keratosis or age spots, solar lentigos. Here you want to hold the CryoClear vertical to the lesion. Gas flows down and out of the device, and so you're always spraying down at the lesion. You freeze the lesion from the center, moving slightly outward and around the lesion for 5 seconds, almost in a circle or in a funnel that you're going down, first coming out of and then going back down. Then as you come out from your first 5 seconds, you'll notice the formation of a white ice ball or white coloring on the skin. Then wait until the ice dissipates, and then if necessary, if you deem it necessary, then do an additional 5-second treatment going back the opposite way. Our next indication that we want to talk about is for the removal of cherry angiomas. So again, you always spray downward onto the lesion that you're targeting, in this case the cherry angioma. You freeze the lesion from the center, moving slightly outward and around the lesion for 5 seconds. You'll notice again the formation of the white ice ball. You want to be close to the cherry angioma. Do not be afraid or think that you will induce pain. If you're too far away, it will not be effective. After you treat for the first 5 seconds, wait for the white to disappear, and then if deemed necessary, repeat the procedure of spraying for 5 seconds on the same cherry angioma. This is very simple. Again, for all of these indications, you can see that it's 5 seconds on, wait a few seconds, then 5 seconds on again. This is the most effective way to get the maximum number of treatments from CryoClear and also to maximize the potential efficacy as well. This concludes the section on some potential suggested treatment protocols, and next we'll be moving to post-treatment.